Hi guys, welcome back to my channel. As you guys can tell by the title of this video, I decided to make a video on IVF. IVF has a lot of questions, with just being a surrogate and pretty much the medications, everything from the side effects, how much it costs. Obviously, it doesn't pertain to any of the surrogates of how much it costs, but just to give you guys an idea of what medications are, in your possession. So I'm just going to start from the top. Before taking any IVF medications, they have you on birth control. Birth control, that is to reduce any cysts that you guys might have or could have. It's to reduce, the chances of getting a cyst. It also will help with the clinic knowing your cycle. So they want to make sure that that your cycle is happening every days, and they're able to track your ovulation. Some people do ovulate before, so they end up having to stop all their medications and trying again. And that's just their body saying, hey, I want to get pregnant, if they do end up ovulating, a little bit before. But birth control really is to help them get an idea of your ovulation day and just keeping track of your cycle. Next, so IVF. If anyone does not know what IVF stands for, it stands for in vitro fertilization. And pretty much side effects. A lot of people get pregnant feeling, boob swelling, nausea. I didn't get any of those symptoms. I did get symptoms after transfer, which to me was like pregnancy symptoms. I did have 2 chemical pregnancies and I felt nausea. My breasts were tender to touch. But as I was taking those medications before transfer, I didn't get any of those symptoms. I did get a little lightheaded the very first time I injected myself. As soon as the medication goes in, it works through your body pretty fast, I feel like, and I got a little bit of dizziness or lightheaded. The cost of IVF, the medications that I researched was around $3,500 to $7,000. That's just to give you guys an idea of how much your intended parents pay for, and we need to make sure that we are injecting these medications correctly, the way that our doctors are saying. If you have suppositories are vaginal inserts. So some people will get estrogen. Instead of the injection, they will get suppositories, which is like a little white pill. You insert it inside your vagina and you get it through that way. I don't really know what the difference is. Some doctors do suppositories, some doctors do injections, some doctors do both. It all just depends on your doctor, but my doctor does injections only. I'm sure that they would probably put somebody on suppositories if they decided that maybe that will work more, or whatever the situation is. I really don't know the whole difference. With all these IVF medications, they what I researched is that the IVF cycle with all the medications is $17,000. So that's just to give you guys an idea of everything. Just this procedure, without the transfer, all of this is about $17,000. So you guys will get estrogen. Estrogen comes in this really small vial bottle. I don't have any to show you guys, at least I don't think so. It'll come in this really small bottle. Let me check. See. Okay, I just have progesterone. So estrogen will come in this small bottle. They only give you one. With the progesterone, they give you multiple. But the estrogen, that is to thicken the uterine of your lining. That is to, to help embryos stick, pretty much. So that's for you to start off with. And, excuse me, you'll take that every 3 days. So what I found very helpful was I did an alarm. And if you have an iPhone, you can set your alarm for, you know, Monday, Wednesday, Friday, and continue on. And then, you know, every week you would have to reset that again because you're going to be taking it on a different day next week. So I highly recommend you use your phone with an alarm set every day. I set it 10 minutes, 5 to 10 minutes before I actually have to inject myself, because it gives me time to stop whatever I'm doing, go upstairs, prep my area, prep, you know, needles and syringes and whatever. And by the time I'm done with that, it'll be the right on the dot of when I'm supposed to literally inject myself. So that definitely helps with me. The estrogen, so you will guys need to stay on these medications with the estrogen and progesterone until you're about 10 to 12 weeks pregnant. Every doctor is different. If they see that your estrogen levels with your blood test, because they will continue to do blood tests, you know, maybe sometimes 2 to 5 blood tests that you guys will have to make sure that your estrogen levels are good. And if your estrogen levels look a little bit off, they might keep you on that medication a little bit longer. Some people I've known that went to 10 weeks. Some people I know that went to 12 weeks. Some people I know that went 8 weeks. So it just all depends on your doctor. But that is to give you guys an idea. So when you guys are pregnant, the estrogen also, what I read was that it also helps with, it helps the placenta function and it helps your blood flow. Okay. Progesterone. Progesterone is, I actually have one. Progesterone is to help maintain your hormones, and it comes in oil, and oil just helps with dissolving the medication, because as you can see, let me see if I can show you guys. Sorry, this sunlight. You can see that it looks pretty loose, but once you draw it up in the needle, it is thick. It is extremely thick. So what definitely helps me with the estrogen, you guys only give a really small dose. With the progesterone, you're starting off, your first day is 1 ml, and then after that is 2 mLs. It is a pretty decent amount, and the oil is extremely thick. So what I find very helpful is that I run the syringe under warm hot water, and that will loosen up your oil, because you will be sitting in your bum for a while with that needle inside your bum because it's just so thick. So it helps loosen it up, and it doesn't feel hot or when you're injecting or anything. It doesn't feel warm. It just feels, when you're pushing the syringe, it definitely makes it much smoother. So I pretty much covered each medication. If you guys have any more other medication, I don't really know. I know some people are on Lupron. I don't even know exactly what that does, but I know that one injects into your stomach. But just to give you guys some tips on what I did, it was very helpful and stuff. So you usually have a bag, and I know if you're probably in California, you'll probably get your medication from this company, but they will give you a very decent stack of alcohol wipes. You'll have a syringe, a 1cc syringe. You will have a 22 gauge needle, and you will have a 18 gauge needle. Now this is with the estrogen. You might be confused, but on the bottle it says estradiol. Same thing, estrogen, whatever. So what I open this, my syringe, your 22 gauge needle, I just open it just a tad bit so I can be able to just pull out, and I won't have to struggle opening them when it's time for me to inject. So you have your syringe. Now this is the confusing part that a lot of people get kind of scared on. I have to remember for myself too. The 18 gauge needle you are going to draw up medication with. So it is the pink one, if you guys can see, the pink one, 18 gauge needle. Now, you are probably thinking, because I have an 18 gauge needle and I have a 22 gauge needle. You're probably thinking, why are you drawing up with the 18 gauge needle? Because it is smaller, you know, the smaller the number. It doesn't work like that. The bigger the number, the smaller the needle. It took me a little while to figure out, but the bigger the number, the smaller the needle. So I have accidentally injected myself with the 18 gauge needle, which is the bigger needle, and this guy is no joke. It was not, I don't know if you guys can see, but that is a pretty big needle. It's a pretty, okay, so let's focus. It's a pretty big needle. So so you're gonna draw up with this. Now, I'm not opening up a medication because this stuff's expensive. But so you draw up, so I did 0.1, so you draw up air first. Don't put medication first. You draw up air. It helps with the pressure because the bottle, it's inside, and if you just go ahead and do that and draw up, it's gonna feel resistant because there's no air in there. You need to put a little bit of air inside the bottle. So you're going to draw up air. You are going to inject. You're going to push down the air. And then you're going to flip it. And then you're going to draw up your 0.1. Once you draw up your 0.1, you're going to recap it. You're going to lay this on the table, have this on the table, and you're going to scoop it up. So if you do it in the air, I'm just demonstrating, you will sometimes miss and poke yourself. So twist this off. And that's when you're going to put your 22 gauge needle in your syringe. And you're going to twist and make sure that's on tightly, because if it's not on tightly, you will start spewing medication from the bottom of it. So you make sure that it's screwed on tightly. Once you are ready to inject, you're taking off it. You're going to inject. Put the medication in. Hold it for as long as you can so that we ensure that the medication is in, and then you can inject out and then recap your needle. And I usually get like a little another alcohol wipe, and I rub the area where I inject at, not my arm but my butt, just demonstrating. I rub it and make sure that the medication dissolves inside. Sometimes you'll have blood, sometimes you'll have medication coming out. If your medication starts spewing out, because it's happened to me a couple of times, you kind of have to eyeball it and inject as much as you think that came out. I'm not saying that if a little bit starts leaking out, don't go ahead and inject yourself. But if you see, it will like legit squirt out of you. And if you see a lot coming out, you just have to eyeball it. But other times you'll see like a little tiny drop of clear fluid. It's fine. Don't inject yourself. You're fine. So that was with the estrogen. The estrogen, you get this small little syringe, and it's only 0.1. So I don't know if you guys can see. So you see the 0.1. Sorry, guys. You see the 0.1. It's very, very small. Very. So it's not much medication. You're going to be like, oh, I feel like I didn't do it, but it's all you get for every 3 days. And that happens for about a week and a half, maybe a week. And then you have your progesterone. So progesterone comes with this 3 milliliter syringe. Needle's already attached to it, which you're going to draw up with. So it only comes with one of these, which is the blue 25 gauge needle. So again, you're going to take off, and this is for progesterone. You're going to take off. Now this, you guys can see, this is a pretty big syringe. So this is the needle that's already attached to it, is the needle that you guys are going to draw up with. So what does this come with? This comes with a 22 gauge needle, so it's already attached to it. I don't understand why they do this with the progesterone. They already have it attached to it because it makes it so much easier. You won't get confused of what to, inject with. And I'm pretty sure I injected myself with this before too. So this is not that bad because you're injecting yourself. Sorry, I don't know. Oh, with the other one, you're injecting yourself with the 22 gauge needle. And remember I told you guys, the bigger the number, the smaller the needle is. Well, this is a 25 gauge needle, and this is much smaller than the 22 gauge needle. So I don't understand why, because the oil is so thick that they want to do the smallest needle as possible. So 22 gauge needle. Now I told you guys I start off with 1 for the first day. I start off with 1 ml. Not much. 1 ml. And if you guys get confused, the very top of the black line, you see the black line moving up and down? That's where you're going to stop at, the very top. Sometimes I will do right underneath the 1. So you're going to do 1. Draw up your medication, like I told you guys. Put the cap back on. Twist it off. Now you have your 25 gauge needle, which is very smaller. Twist it on. And you don't need to push your medication up to the top of your needle. That's not what the videos say of how to inject. You're going to take the top off and you're going to inject. And this is a 25 gauge needle. It's very small. It's long, but I'm like skinny wise, it is very small. So, when I first started injecting, I did ice. I put ice on my butt and then I injected to make it numb. I got so tired of getting ice and numbing my butt that I decided to just inject, and it was no complete difference. Of course it numbs it a little bit, but I was over it. It took too much time, so I decided to just inject. It felt much better anyway by doing that. With the sharps container, to make it a lot more room in here to get as much as you can, make sure you guys pay attention because there's a line that you guys should not go over. So don't put the entire needle in here. Twist it back off, drop it in here, and then put the syringe in here. It makes it much more easier to have much more room. Or else you're just going to get these long, syringes with the needles on it. I think one time I accidentally tightened it too much and I couldn't get it off. So just make sure that you guys are able to unscrew it. But that is it for my video, guys. If you guys have any more questions about IVF, feel free to ask me. But that is pretty much it on my video. I hope you guys enjoyed it. Sorry, my throat is like really scratchy right now. But I hope you guys enjoyed it. Just a quick little update. I will probably be doing a transfer February time frame. Just because of the holidays, everything gets pushed back. So February is what we're looking at. Right now, I might be doing my medical clearance. I really don't know when, because Thanksgiving is next week. I do have a period coming up, so I think they like to do it when you're on your period. I really don't know. I don't remember. But that's it for me, guys. I will see you guys in my next video. Thank you so much for watching. Bye.